And we are live. Hello, everybody. Good afternoon, and welcome to the final day of our Lunch and Learn series. I'm Heidi Berardi with United Way of Greater McHenry County, and we thank you for joining us on this beautiful Friday. So today we are going to talk about United Way's impact on healthcare in McHenry County. And we have three very special guests with us today. Just going to go around and introduce them briefly. We do have Pat with Family Health Partnership Clinic, and Bob with the Greater Elgin Family Care Center, and also Amy with Independence Health and Therapy. We are going to have a great discussion today. And without further ado, I think the best way for our guests to learn more about you is just to start talking a little bit about what you do in the community. So Pat, let's go ahead and talk a little bit about Family Health Partnership Clinic.
Well, hello, everybody, and we're thrilled to have you here listening to us today. Family Health Partnership Clinic is located in Crystal Lake. Its origins are about 25 years ago, starting out in Harvard, moved to Woodstock for a number of years, and we have been in Crystal Lake since 2013. We provide primary care to the uninsured of McHenry County, and it is mostly adult primary care because of the Medicaid, the All Kids program in the state. Years ago, we did see more children, but now we see primarily adults. We see about 2,000 unduplicated patients and about 6,500 visits a year. And one of the things we're most proud of with our models is a very integrated healthcare model. So we will see our patients, they see us really as their medical home, not only for chronic disease management like our diabetics and our hypertensives and our asthmatics and so forth, but also for any of their acute care needs. So we will see them for obviously the COVID issues that we've had come up recently, and flu season, colds, cuts, abdominal pain, anything along those lines. The one group we really don't see besides kids would be pregnant women.
Ah.
Other than that, though, we have a very, like I said, integrated model. So we will see them and have the ability to refer them on for testing and specialists. We have integrated mental health right on site 2 days a week. We have a health coach who works especially with our diabetics. We have a patient navigator who helps our patients with anything non-medical, the transportation issues, job loss, any of the social determinants that she can help them with. So we have a fully integrated staff and specialists who come into the clinic to see our patients, usually on a monthly basis, which would be podiatrist, orthopedist. Women's health is a huge program for us where we can get our women mammograms and pap smears free of charge. A lot of our docs that come in are internal medicine or family medicine. And then we also have dental that we've added in the last few years. And then finally, we also have a homeless outreach. So we really try to connect our patients not only with their physical needs and on-site dispensary, but also other needs and on-site food pantry, and the way to connect with other agencies within the community.
And I love how you started off with talking about really treating individuals holistically. So like this has been a running theme throughout all of our conversations. When you work with a nonprofit organization, they aren't just going to treat whatever symptom. They're going to talk with you about, the things that you need to be successful. So as you watch these comments today, and if you know somebody who needs assistance or you need further assistance, it's going to be really important to reach out to these organizations. And again, if they can't assist you, they're going to send you to somebody who can. So thank you for that. So Bob, let's talk a little bit more about the Greater Elgin Family Care Center.
Of course, and good afternoon, everybody. So why is Greater Elgin Family Care Center on this when we're talking about McHenry County? Well, that's because Greater Elgin Family Care Center operates the McHenry Community Health Center on Route 31 on Mercy Drive in McHenry. It's in fact one of our 9 health centers that we operate in 5 different counties in the Chicagoland area. And we're really proud of our McHenry Community Health Center, which has been open almost a decade now. and provides the full range of primary healthcare services to patients, publicly insured, uninsured, commercially insured. We really focus on folks whose income is less than double the federal poverty level. We're a federally qualified health center. So as a result of that, we have a bunch of regulations that we comply with that really allow us to produce some great things for community residents. So first is access to care. Our health center, our McHenry Community Health Center, is open 6 days a week, 4 evenings till 7:30 at night. Secondly, we offer a very wide array of integrated services, including pediatrics, family medicine, OB, GYN, psychiatry, outpatient therapy, individual, family, and group. Of course, we also have a fully integrated laboratory operated by Laboratory Corporation of America. And of course, we do take all the different Medicaid plans that might be out there. We also take uninsured patients. We also refer a great deal through our case management system to organizations such as the two that are here with me today, in case they provide services that we do not provide. We also refer out to Northwestern Medicine and other health systems as necessary. In fact, our obstetricians deliver about 350 babies a year at Northwestern Medicine McHenry Hospital through the prenatal care that they receive at our McHenry Community Health Center. I think it's also important to note that we have, our McHenry Community Health Center does, a person who is a health benefits specialist who's trained and certified to help people who are newly uninsured or perhaps confused if they're eligible for public insurance and able to enroll them into those public insurance programs. That can be done as a walk-in or appointed. So our McHenry Community Health Center is a large source of care. Last year, 2019, we provided care to almost 7,800 McHenry County residents. And my sheet here says it was 27,500 appointments provided just at our McHenry Community Health Center. And that's just one of 9 health centers that Greater Elgin Family Care Center operates.
For a minute there, I thought you were going to say that was for your whole footprint. That's incredible that you did that much for just your particular location in McHenry. So yeah. I think you brought up a good point too about being federally qualified. So sometimes people might think nonprofits may not have to be as regulated, if you will. And having worked for nonprofits almost my whole career, they are the most regulated entities. And so the quality of healthcare that you would receive in coming to these different places is going to be exceptional. Their eye is always on detail and they've got great, is it mostly volunteers, guys, that come in with for healthcare, or some of them actually unemployed as well?
Well, in our case at our McHenry Community Health Center and through our entire organization, one of the regulations is that all of our practitioners and staff are paid. And in fact, they're fully credentialed and privileged by our board of directors. So every one of our practitioners is licensed, certified, and vetted through our organization. That's part of our regulations that we have to meet.
Outstanding.
Yep, and for us, we have the doctors and the nurse practitioners who come in are usually, they're on staff, some through Advocate, Mercy, or Northwestern. And then we also have 4 part-time nurse practitioners on staff.
That's incredible. We're also grateful for the work that you're doing in the community. So Amy, let's talk a little bit about Independence Health and Therapy.
Sure. Hello. Well, first, I did want to piggyback on that, Heidi. I do appreciate you bringing up the point about the quality of care that we all provide. You are right on that we all do hold ourselves and we are held by our funders to a very high standard. And so sometimes I wonder if there's a misconception about the quality of care, and it is at the highest of levels of what we do provide. And thank you again for inviting us on. I feel very honored to be with Family Health Partnership and with Elgin Greater Community. It's great to be part of, to be on this panel with you. Independence Health and Therapy is really, the origins has been around since really 1949. If you go back to the 2 agencies that really formed Independence Health and Therapy was Family Alliance, a former Family Alliance, and Adult and Child Therapy Center. And Adult and Child Therapy really began in '49 as Easter Seals. And just recently, the two agencies merged and we're Independence Health and Therapy, and we offer really three kind of service lines. We have our adult day and our memory care program, which is a day program for individuals in the community that have Alzheimer's disease, or cognitive issues, maybe chronic illness. It is a day program. The objective is to provide independence and keep our adults in our community as long at home and aging in place as long as possible. We also have, again, to speak to my other panelists here, we do believe in a very comprehensive and holistic approach to our care. So we also have a very vibrant behavioral health department too, so which is helps out all of our other programs as well. So we have geriatric psychiatrists here on staff. We have licensed counselors and therapists. We also have community support specialists who are working specifically with our epilepsy and TBI population in our county. And additionally to our therapies and our adult day room, we have our physical and our occupational and our speech therapy programs that have been around, like I said, since 1949.
Wow.
We serve everyone in McHenry County, but especially those that are probably the most vulnerable, that have that are on managed care systems or have no insurance, or have some sort of Medicaid. So we're very open, and we definitely believe in serving all that come through our doors. So.
Wonderful. Thank you for sharing that. So many people that are watching us today maybe support the community through a workplace campaign. They would love to see a little more about how the dollars go to work in your organization. So if you would talk a little bit about some of the dollars invested through United Way at your particular organization, why don't we again go back to Pat?
Okay. So the dollars from United Way are hugely instrumental in what we're able to do. They allow us to provide our healthcare delivery model, both direct and indirect patient care, with the clinical time. Again, while we value so much our volunteer docs who come into the clinic monthly or even more than that, we do have our staff NPs who we have to pay for their time to see our patients and the number of hours that they put in for us. So that kind of direct clinical care, we have a part-time nursing staff, but it's an all RN staff of 8 nurses. And again, providing invaluable direct patient care, not only with the tasks that go along, but also the huge amount of patient education that is done. Our diabetic education programs is a big part of what we do. As far as just teaching our patients how to use their meters, what do their numbers mean, their diet, their activity, everything that goes into being a diabetic when they hear that diagnosis, and meeting with us many times more than once, because it's just so much information to take in, and especially for our patients who don't speak English, and to have the ability to have that interpreter sit right there in live time and explain it to the patients in very simple terms along with the nurse is huge. And as far as our dental, again, to be able to get the supplies, dental is a very expensive clinic to run because of all of the materials that we need to get, and that ability for us to be able to do cleanings and extractions and root canals. And for these patients, who many of whom have never been to a dentist, and to be able to have that kind of dental care brought in, because again, the state of their teeth and their mouth really impacts how they eat impacts their overall health. So it really is connected that way. And the labs that we do, as Bob said, to be able to have a laboratory right on site, and the medications that we're able to dispense, have them be able to leave the clinic. Transportation is a huge issue. So if they're able to come in, get their visit, get their meds, get their labs all done, have them addressed the next day, it's huge for our patients.
Yes, I would agree with the dental is critical.
The dollar.
Thank you. Okay, and Bob.
Well, I would agree with a lot of what Pat said. There's no doubt that the allocation that we receive through the United Way of Greater McHenry County is essential to our mission at our McHenry Community Health Center. You know, the data here says that 38% of the patients that we see, the roughly 7,800 a year that come to our McHenry Community Health Center, are uninsured. So we're receiving no reimbursement for those patients, which is about 3,000 people a year. Yet, of course, we're providing all the services as you would expect a community health center like Greater Elgin Family Care Center to do. But not only does that money help support our operations, but allows us to do new things like COVID-19 testing. So we have been the beneficiary, our McHenry Community Health Center has been, of COVID-19 impact funding, which has allowed us to do both nasal pharyngeal swabs, nasal swabs, and serology testing 5 days a week. In fact, we're testing about 60 patients a day using a PCR test to determine whether or not they have COVID-19. So they have flexibility to be able to have some resources from the local community to begin offering that service has been a second item. But the third item it really does, and I want to jump a little bit on the quality bandwagon because a lot of people, underestimate what not-for-profits are capable of. Greater Elgin Family Care Center, and specifically our McHenry Community Health Center, just this week was awarded 7 national awards for its quality of care, including yet again a hypertension control championship by the Centers for Disease Control. And of course, that can all be realized by looking at our website and coupled with our patient satisfaction scores that are posted right on our website as well. So indeed, there's a lot of evaluation and that costs money as well. So the resources really help us on day-to-day operations, adjusting to things like adding COVID-19, and then helping our infrastructure so we can measure our outcomes and make sure we're providing the highest quality care possible.
Thank you so much. And Amy.
Well, yeah, thank you very much for the United Way of Greater McHenry County. Their funding is critical, and I will have to say that our adult day and memory care program had been closed for 5 months during COVID. It was the state had mandated the closure of our program and all congregate programming. But thankfully we reopened last week, and so we are blessed, and our clients are blessed that they are able to come back now. It has been a challenging 5 months for our clients. We have seen decline. Some will not be coming back. They will need to find now alternative care. So how that really relates to United Way and our funding, we could not be continuing and existing here if it weren't for funding from United Way, from our other county partners, the county board, mental health board. It has been very crucial that we've continued to have support. And now we are open again, and we've been able to retain staff and our drivers, because we offer door-to-door transportation as well. And so our drivers are back on board, and it is bringing great joy to everyone here to have those services. And had we not had this funding, it's been very critical. In addition, just on a regular annual basis, again, we are able to serve everyone because of this funding. We do not turn people away. We are able to take those managed care individuals that have managed care. And I just was told of a story today of a little girl who is over at she received speech therapy and she received physical therapy, and she was a client before COVID. Unfortunately, she's just about 1.5 years, and so she wasn't able to really do any teletherapy, although we were offering that. So she had to kind of stop services for a little while, and then now the last couple months she has come back into the clinic in person. And she is a very delayed young little girl, and had been not, when we first saw her, was not walking, was only being able to swallow, being tube fed. I'm happy to report that because of our continued services that we were continued to be able to offer, she had her first ice cream cone recently and was able to enjoy that and is now starting walking. And it is only really because of this funding that we get. We really don't, unfortunately, the way that a lot of managed care organizations work is that someone like her, she requires long-term services from us. And with that, it's very challenging to get reimbursed and paid for that. And so there's a high percentage of what we offer that just will never be, it won't be reimbursed. They won't cover it because it's long-term, but yet our medical professionals know that they need this care, they need this therapy, and so they're going to continue to give it because they see the progress. And so, so thank you to United Way and everybody out there who has contributed to the United Way campaign, because little girls like her can continue to progress even when there's delays in insurance and all of that, and when they're not reimbursing at what we need. So we're able to provide the quality. To Bob's point, we hire quality therapists to do the work, and they're able to do it one-on-one, and it's great. So we're very grateful.
That's an incredible story. I'm so glad you're back in action. And for those of you who are watching, you can see the impact you're having on the lives of others is just unbelievable. So again, I probably could talk to you guys all day. Got to think about a couple of the other questions I want to get in here. So obviously with the changes in COVID, how are you doing intake? So if somebody wanted to have an appointment with you, is it appointments only? You're probably not taking walk-ins. Can you just talk just 2 seconds about that, each one of you?
So we are appointment based. We do not take walk-ins ever, even before COVID. And we have screening questions. So when our patients call, they have their screening questions that we ask our patients. And for anybody walking right into the clinic, we have now a table set up with screening questions and temperatures taken, and the ability to have them wait right there before the nurses would bring them back. And then, so we really try as much as possible. We will still see sick people if they need to be seen, but we want to be better prepared before we bring them back. And we have been able to do medication pickups outside. So the nurses will go out through another door, patients wait in their car, and we will bring their medications out to them. So really trying to mitigate the contact.
Great.
You know, at our McHenry Community Health Center, we deployed universal masking within a week of the pandemic happening. And that was a critical factor for us because it's allowed us to remain fully operational. So we do take appointments for all the specialties, pediatrics, family medicine, OBGYN. We also still take walk-ins regularly on a daily basis. And the COVID-19 testing that we do, that is only by appointment only. And that comes in through a separate entrance and a separate exit, and is in a sequestered corner of the health center. But in addition to those items, we also have implemented virtual visits. So there's quite a few of our visit types in pediatrics and family medicine, and certainly in psychiatry and outpatient therapy that could be done virtually for patients as well.
Incredible. And Amy?
We are a bit of a hybrid of everybody as well. So we do in-person by appointment intakes. Our behavioral health does a lot of their intakes via telehealth as well, though, but we do have in-person intakes on that program. Our adult day and memory care, right now we are taking new intakes and by appointment here in person. Our therapies as well. It kind of depends on the therapy and the therapist, but most of it is done in person. Some of our speech, if there's assistance on the other end, we can do some of that a little bit virtual as well, but we prefer in person by appointment.
Great. So as you guys can
we
see,
go through the same protocol and temperatures and screenings before people come in as well. So we're following all the protocols.
And I think it's just really great to see, and I think everybody here can attest to it, is the flexibility we've all had to have, just like everybody's had to have in their own lives, and the adaptability that our staffs, our agencies, our partners in the community have all been able to bring about. Like Bob said, we're same thing. We're doing telehealth, things that we never thought that we would be doing. We are doing and adapting to what's happening. And again, to speak to the nonprofit world, that we are holding our own and being able to continue what we're doing and at high levels.
Definitely. So great, accessible quality healthcare. That the conversation just demonstrated that there really aren't the barriers. You guys have helped to remove the barriers, which is incredible. So you all have great presence on social media, and I just wanted to kind of go around and talk a little bit briefly about some of the things that you're highlighting these days on social media. So I know, Bob, I saw with the clinic that you are actually doing student back to school annual exams, and those are still important, even though that people are maybe not going back to school.
Well, they absolutely are. We have Dr. Karen Ali, full-time pediatrician, one of our practitioners, and our other 5 family medicine practitioners at our McHenry Community Health Center. They all can provide back-to-school exams as well as immunizations and sports physicals. Access to care is really important, and people keeping their children healthy and properly immunized is really important for their success in school, for their learning, for their general health. So like the other parties here, our McHenry Community Health Center provides that regardless of ability to pay to all comers, both appointed and walk-in. And we're happy to partner with all the school districts in the county to be able to provide those services to those children and their family.
That's wonderful. So one of my favorite things about the Family Health Partnership Clinic is that you guys actually have an internal food pantry. And I've seen some posts lately about the fact that some of us in the community could possibly contribute to that, even like through some of our gardens. Is that right?
Yes, so our garden program has really, really taken off. It started last year. We actually rented out our own plot, and some of our community supporters were growing for us within this plot. We switched it up a little bit this year, where community gardeners in their own plots are bringing us food. And the amount of food, the tomatoes, the squash, the cucumbers, and all of the fresh produce coming in. We actually have a little food pantry closet that has a lot of the cans, non-perishable items, which also is so important. And when COVID started, we were giving bags of food to people. They came to pick up their medication. They would have bags of food plus cleaning supplies, wipes, gloves, everything that they would need along with food. So we would drop that off at their car. But what's happened with summer now with the harvest is coming, we have a whole shelving unit set up in our lobby with all the fruits and all the vegetables lined up on it. And it's so important, especially for our diabetics and any health condition that's impacted by good nutrition, to be able to walk the talk, show them this is what we're talking about, substitute your food out, here's some recipes for you. But to have the response from the community has just been overwhelming with the amount of produce.
I really do think all of us want to help where we can and when we can, whatever our circumstances might be. So let's shift from the concept of healthy bodies to healthy minds. Amy, you guys have a caregiver support group. Let's talk a little bit about that, because that really is essential to the whole family.
It certainly is, and really goes back to kind of that comprehensive care that we talked about, that we believe that it's very important that we're treating the entire family. And so if we have a loved one who may be part of our day program, or maybe they have a little one that has autism or is being seen as in our physical therapy because of cerebral palsy, those caregivers are needing support. And so we have a series of caregiver support groups, and these they're virtual right now, and they continue to be virtual. We have a Spanish speaking support group as well. But again, it's about, especially during this time, we all as caregivers, of either just our own children or our parents in whatever walks of life, we've all had to become different sorts of caregivers. And for those that are already experiencing some sort of significant healthcare issue, it has been very, very trying over the last few months. with being quarantined and the lack or just not being able to get out and have your normal routine and the respite that you might have. And so our caregiver support groups are really divided a little bit into helping the actual caregiver with their own coping and their own mental health. And then we also have support groups that are really focused on navigating behaviors and helping them be a better caregiver to their loved one. So if they're experiencing challenges with their mother who may be having, who has dementia, helping them problem solve and navigate through some of the challenges that they may have. So they all up on our Facebook page. So I encourage anyone to just drop in, and they're drop-in support groups right now. It's a Zoom link. It's a constant link. We have it up there. You can just pop in, just check it out even for a little bit, or pass it along to someone who may be needing that. Even if they just have one question to say, hey, I don't know what to do with my, my mother. She won't wear a mask when we go out, and I can't take her out because she won't wear a mask. What can I do to help that? So, we have our, those support groups are staffed with our mental health professionals, with our nurses, with our staff that are really trained and have worked with these populations all the time. So.
Great, and that's a perfect segue as we wrap things up. Let's go around and have everyone really tell us how we get a hold of you. How can I reach out to learn more and to maybe engage in your services? So Pat, take it away.
So we have our presence is on not only via our website, which is a very lots of information, everything that we do in our events. That would be hpclinic.org. And we also have a presence on Facebook, as Heidi mentioned, Twitter and Instagram. So you can find us at any of those places. You can see what we're doing. Take a look at the garden produce we're getting.
And at our McHenry Community Health Center, we of course have a website. It could be accessed either through McHenry Community Health Center or Greater Elgin Family Care Center. Appointments can be booked virtually through our website, or persons in need can give us a call at 815-363-9900. And of course, like every other organization, our McHenry Community Health Center is on all the different social media systems. We do quite a bit of tweeting as well, I might say, perhaps more than I would like, but we do a lot of tweeting of helpful information to community residents as well.
And right now for Independence Health and Therapy, I would say that the best, most accurate information is probably on our Facebook page. Our Facebook platform is where we are able to put out the most up-to-date information. Our website's under a bit of construction, but you can always go there too, independencehealth.org, and our Facebook page, Independence Health, and call us at 815-338-3590 as well. Anyone can help or answer any questions.
Thank you all for such a terrific discussion. And we really appreciate your support, all of the wonderful things that you're doing in the community. We wish you nothing but the best. Safe blessings to you. And if you are watching today for the first time, or perhaps you are in a workplace campaign and you want to learn how to do more, check out our website at uwmchenry.org. Our United Way invests not only in these 3 organizations that focus on healthcare, but 30 other organizations that offer almost 50 different human service programs in the county. So find that donate button if you're so compelled and help out these wonderful organizations. Everybody have a great weekend, and thank you again.
Thanks.
Thank you.
Bye.